Hey guys, what's up? Today we are going to learn about the Varicella Zooster virus. In this video, we will talk about the DNA virus classification, the diseases and the properties, the transmission and epidemiology, the clinical findings, lab diagnosis, and finally we'll talk about the preventions, how we can prevent the Varicella Zooster virus. Let's begin with the classification. So there are RNA viruses also, but today we are talking about the DNA viruses. So in this video you can see that the DNA viruses are of two types, double-stranded and single-stranded. The double-stranded are further classified into enveloped and the unenveloped one. So in the unenveloped, we have adenovirus, papillovirus, and polyomavirus, and in the enveloped we have adenovirus, herpes virus, and pox virus. And in the single-stranded DNA viruses, we have unenveloped one. There are no enveloped single-stranded RNA viruses. So we have the parvovirus. So if you talk about the Varicella Zooster virus, Varicella Zooster virus is a DNA virus. It is a double-stranded DNA virus, and also it is an enveloped virus. So let's talk about the diseases that are caused by Varicella Zooster virus. So it causes the primary disease, which is the varicella, right? And it is also known as the chicken pox. So in case of secondary disease, it causes zoosters, which are also known as shingles, right? So you can see here that it causes the varicella and the zooster, the primary and secondary diseases. So let's talk about some properties of this virus. So it is having single serotype. Its natural host is human. It is having icosahedral core. It means that it is having 20 corners, right? And it is double-stranded DNA, and it is having tegument. What do you know about the teguments? So teguments are located between the nucleic acid and the enveloped. You can see in this picture that it is the enveloped and it is the nucleic acid. So in between these two, there is a tegument. It is basically the structure contain regulatory proteins such as transcription and translation factor, which play a role in the viral replication. Let's talk about the transmission of the Varicella Zooster virus. So it is transmitted through respiratory droplets, you can see, and through the direct contact. So you have to avoid the direct contact and prevent yourself from the respiratory droplets of the infected or affected person. And about the epidemiology, what do you know? Varicella is a highly contagious disease of childhood. More than 90% of the people in the United States have antibody by age 10 years. Varicella occurs worldwide. Prior to 2001, there were more cases of chickenpox than any other notable disease. But the widespread use of vaccine has significantly reduced the number of the cases. So if you talk about the pathogenesis, the Varicella Zooster virus is there. It will enter through inhalation into the mucosa of the upper respiratory tract. Then it will invade the blood. From blood it will reach the skin and will cause a vesicular rash. Multinucleated Gantt cells with intranuclear inclusion are seen in the base of the lesion. The other way is that Varicella Zooster virus enters the sensory neuron or reaches the sensory neuron, and you know that sensory neuron have a dorsal root ganglia, so they invade there and remain latent there, and they get activated again when the person get immunocompromised. So if you talk about the clinical findings, we have varicella and the zooster, the chicken pox and the shingles. So the varicella is having an incubation period 2 to 3 weeks, and the person will have fever and malaise. Malaise is just like muscles ache or general body ache, and the person will have papulovesicular rash. He will have pruritus, reddish appearance on the skin. The person may have a pneumonia after inhalation, encephalitis. The person get affected, and the brain get affected, and the Reye syndrome. And what is Reye syndrome? It can also happen in the children if they are getting aspirin. So Reye syndrome is characterized by the encephalopathy and the liver degeneration, and is associated with Varicella Zooster virus and influenza B virus infection. So if you talk about the zooster, the shingles, they have the vesicles, and they also reaches the sensory nerves and in the area of the head and trunk. And the other thing is that they can cause post-herpetic neuralgia, right? So the person can have a nerve problem. Pain can last for weeks, right? And in immunocompromised patients, especially in stem cell transplant patients, life-threatening disseminated infections such as pneumonia can occur. In case of lab diagnosis, you can do PCR test, you can do culture by using T-Zang smear, you can isolate the virus in culture, and also you can use antibody titer. What will you do here is that you will see some antibodies against the infection. If the antibodies is more than 4 times, then it can indicate that there is the virus present or the disease is there. So you can know that the Varicella Zooster virus invaded there. How you can prevent the Varicella Zooster virus? So there are two vaccines, right? And the two vaccines are Verivax and the Shigrix, right? Shigrix vaccine. The Verivax is basically live attenuated vaccine, and it can be given to people who are greater than 12 months or children who are greater than 12 months, right? And they are contraindicated in pregnant ladies and also immunocompromised patients. So if the patient are immunocompromised, you cannot give that vaccine to them because it is having a live virus and it can cause damage or disease there. So you can't give it to immunocompromised patient and a pregnant woman, right? And in case of a Shigrix, which is a recombinant vaccine, it can be given to adults of any age. So what about the prophylaxis? Right? Prophylaxis is getting medication or chemical drugs before having an infection. So if you want to prevent yourself from the infection or disease, you have to take the prophylaxis. So in case of Varicella Zooster virus, you can take the acyclovir or the Varicella Zooster immunoglobulin. So in this way, you will be prevented by these two for the Varicella Zooster virus, right? Thank you so much for watching. Subscribe for more and always stay motivated.